Endometriosis is a reproductive disorder where the endometrial tissue grows outside of the uterus. The uterus is where a fetus develops, and the uterus is lined with this endometrial tissue. And the unique function of endometrial tissue is that it actually goes through this process that you may have heard of thickening and thinning. The thickening happens to prepare to receive a fertilized egg, and if that doesn't happen, then the thickened tissue actually sheds, and this is your period. When the endometrial tissue grows outside of the uterus, it can actually start to develop and build up on ovaries, the pelvic lining, fallopian tubes, and it can create pain, cysts, scarring, and adhesions. And also it can lead to abnormal ovarian function, infertilization, and implantation issues. If you're concerned that a patient may have endometriosis, these are some signs and symptoms that you need to be aware of. They may complain of pelvic pain. This is actually one of the most common complaints from these patients. They often have very painful periods, more than the usual, very, very heavy cramps. They also have pain with sex, and they may have very heavy periods, a lot of bleeding. Sometimes later on they may complain of infertility, they can't get pregnant. And then one that might get missed is actually pain with urination and bowel movements. So these are important things to be aware of when you are trying to determine what their cause of any of these symptoms are.